Which lead group monitors the inferior wall of the heart? A. 1. AVL, V5, V6, B. 2, 3, AVF, C, V3, V4, D, V1, V2. Answer is B. 2, 3, AVF. These three leads look at the heart's activity from an inferior, bottom, perspective. A QT interval is generally considered normal if it is less than which value relative to the RR interval? A. R to R divided by 2. B. R to R divided by 4. C. 2 times the RR interval. D. The same as the RR interval. Answer is A. R to R divided by 2. It is suggested a quick check where the QT should be less than half of the preceding RR interval. In the interpretation of atrial fibrillation, what is the typical atrial rate range? A. 150 to 250 beats per minute. B. 350 to 650 beats per minute. C. 100 to 150 beats per minute. D. 60 to 100 beats per minute. Answer is B. 350 to 650 beats per minute. Atrial fibrillation involves very rapid, chaotic electrical activity in the atria within this high range. The ST segment should normally be at the same level as which other segment? A. The T wave peak. B. The P wave. C. The QRS peak. D. The PR segment. Answer is D. The PR segment. Both the PR segment and the ST segment should be isoelectric, meaning they sit on the baseline. How many large squares are contained in a 6-second rhythm strip? A. 60 squares. B. 30 squares. C. 15 squares. D. 5 squares. Answer is B. 30 squares. Since one large square is 0.2 seconds, 30 squares multiplied by 0.2 equals 6 seconds. 21. In lead 2, what is the normal direction of the T wave relative to the QRS complex? A. Usually same direction. B. Always opposite. C. Flat. D. Biphasic. Answer A. Usually same direction. In a healthy heart, the vectors of depolarization and repolarization usually result in the T wave and QRS pointing the same way. Which conduction system site has an inherent rate of exactly 60 bpm? A. Atrioventricular node. B. Purkinje fibers. C. Sinoatrial node. D. Bundle of His. Answer A. Atrioventricular node. The diagram specifically labels the AV node with a single value of 60 bpm. What does a QT interval represent? A. The time between two heartbeats. B. Atrial and ventricular depolarization. C. Onset of depolarization to completion of repolarization of the ventricles. D. Only atrial activity. Answer is C. Onset of depolarization to completion of repolarization of the ventricles. This interval covers the entire electrical cycle of the ventricles, from fire to recharge. What is the primary characteristic of the rhythm in sinus tachycardia? A. Sawtooth. B. Regular. C. Irregular. D. Chaotic. Answer is B. Regular. Despite the fast rate, greater than 100 bpm, the rhythm remains steady and driven by the SA node. Lead 1 and lead AVL both monitor which part of the heart wall? A. Lateral. B. Septal. C. Inferior. D. Anterior. Answer is A. Lateral. According to the unipolar and augmented lead lists, 1 and AVL view the lateral side of the left ventricle. A QRS complex is generally considered narrow if its duration is within which range? A. 0.35 to 0.45 second. B. 0.02 to 0.04 second. C. 0.06 to 0.10 second. D. 0.12 to 0.20 second. Answer is C. 0.06 to 0.10 second. This is the standard range for a normal, narrow QRS complex indicating healthy ventricular conduction. Third-degree AV block is also commonly referred to as which of the following? A. Complete heart block. B. Bundle branch block. C. Wenckebach. D. Mobitz 2. Answer is A. Complete heart block. In third-degree block, there is no relationship between the atria and ventricles, meaning the block is complete. What is the significance of the J point in ECG interpretation? A. It represents the peak of the T wave. B. It is the junction where the QRS complex ends and the ST segment begins. C. It is the start of atrial depolarization. D. It marks the end of the P wave. Answer is B. It is the junction where the QRS complex ends and the ST segment begins. The J point is critical for measuring ST segment elevation or depression accurately. Lead V2 monitors which heart wall? A. Septal. B. Anterior. C. Lateral. D. Inferior. Answer is A. Septal. V1 and V2 are placed on either side of the sternum to look at the septum. If a rhythm strip has 8 R waves in 6 seconds, what is the ventricular heart rate? A. 60 beats per minute. B. 160 beats per minute. C. 40 beats per minute. D. 80 beats per minute. Answer is D. 80 beats per minute. 8 beats multiplied by 10 to reach 60 seconds equals 80 beats per minute.